Hi everyone. So my name is Haresh, and as Karen said, I'm a kidney doctor in training based in Leicester, and I'm also doing a PhD with the Leicester IgA Nephropathy Research Group. So I met John back in 2010 when I was a medical student doing my first ever clinical rotation into clinical medicine on the kidney wards. And at that point, he got me hooked not just onto kidney medicine, but also onto kidney research. And since then, over the years, I've been introduced to this amazing community of people that's interested in IgA nephropathy research. And it's a global community of doctors, scientists, nurses, and most importantly, patients. And I've found over the years that it's a really productive community that does quite a lot of work. And the slides that John, Chike, and Alex shared earlier on in the day highlight how much development has happened as a result of that really positive community that's working really hard all the time. And so, as Matt was explaining in his talk, I'm going to lead on from there and talk to you a little bit about how I think this community has really come together to identify what's really important for someone with IgA nephropathy, and talk to you a little bit about the research process that we go through to try and develop on this and really do something about this. So over the next few slides, I'm going to talk to you about kidney pain in IgA nephropathy and what I think we can start doing about it. So kidney pain. So we know that the kidneys sort of live just over there, so towards your back. And when you get pain in your kidney, often it happens in that same area as well. But the reality is it can kind of happen anywhere depending on who you are, because we're all different people ultimately, and we experience things in slightly different ways. So it may happen over your back, it may move over to your front. It's different for different people. But what we do know about it for sure is that it happens. And we know from the work that Matt did in particular, is that it interferes with life. And the thing about it is that before Matt and the group that Matt was working with published that paper, all we knew about it was that patients would tell us about it, and they'd tell us that it was an issue. And they'd want to know if there's anything we can do about it, if they can do about it, and we just wouldn't have answers for it. And the reason for that was that it was something that just really wasn't looked into in much detail, and there was very little information published about it. And I think part of the reason there's very little information published about it was because whenever we need to do research, we need to ask for funding. And when we look for funding, we need to show that we're going to give something back for the money that's being put in. But as a result of there being absolutely no information about it ever out there, it was very difficult to build a platform off which we could ask for more money to research into this. And so that created this sort of vicious cycle in which this kidney pain as an issue in IgA nephropathy just wasn't looked into for a very long period of time. But then, as I was saying, with the work that Matt did, which was really great, so it looked at, I'm just going to go through this quickly because I know Matt's already spoken about it. So it was essentially looking at Facebook posts, and it was looking at themes that came out of those Facebook posts, and it was looking at Facebook posts in this IgA nephropathy support group. And so what this paper for the first time showed was that there were all these issues that patients with IgA nephropathy had, and they were very different to the issues that the research community thought was important to deal with. And of course, kidney pain came up as one of those issues. And the paper described kidney pain as being a pervasive and unwanted symptom. Most patients wanted advice on how to control it because they found it intrusive and unrelenting. And as Matt said, disappointingly, it was dismissed by most doctors when patients did bring them up with their clinicians. So the paper laid out some very strong arguments for why we should start taking this symptom very seriously and why we just need to start working on what we can do about it. So about 9 months or so ago, John and I put together a proposal, and we approached a pharmaceutical company to say, maybe if we can get some funding, we can start looking into this in a lot of detail. So we called our overall project the Anchor IgA Nephropathy Project, and we approached this pharmaceutical company to try and get some funding for it. And they absolutely agreed it was an important issue for us to get to the bottom of, and were happy to support us with this project. So what are we going to do with this project? So the way we saw this was we thought it would be best to divide this into 4 different phases. So in the first phase, what we hope to do is establish the scope of the problem. So we now know that kidney pain is an issue and it affects people with IgA nephropathy, but there's a lot of questions that we still have about it. And it would be very important for us to get to the bottom of those questions. And that's what phase 1 is going to be about. And what we hope to do is essentially survey everyone who has this and find out a little bit more about it. But surveys are really good, and they give us a sort of broad idea as to what the problem could be, but they don't give us any granular, detailed insights into how it can affect someone on an individual basis. And so in phase 2, we're hoping to do that with interviews, one-on-one interviews and focus groups with small groups of people that experience this pain. And then really importantly, to help us try and understand how we can better manage the pain is understanding what biological mechanisms might actually drive it. And that's what phase 3 of the study is going to be about. And then phase 4, this is the phase that we really want to move towards, is trying to work out if there's any way we can predict A, who gets the pain, B, when the pain might happen, and then C, if there's any therapies at all we can use to try and get on top of the pain. So that's a rough overview of those 4 phases, and I'll tell you about them now in just a little bit more detail. So phase 1, as I said, it's all about establishing the scope of the problem. So to tell you about phase 1, I also need to tell you about another national group, and that's called RADAR. So RADAR is the National Registry of Rare Kidney Diseases. Essentially, it's a database. It's a national database set up by an organization called the UK Kidney Association. And what they do is that they catalog anyone who decides that they're okay to be cataloged with IgA nephropathy and other kidney diseases that are considered to be relatively rare. Now, this is really, really important. Now, we know that anyone can get IgA nephropathy, and it's fine for us to know what proportion of patients might get IgA nephropathy compared to other kidney conditions. But what we know is that if you do have IgA nephropathy, every single person with it has a slightly different journey going forward. So the kidney disease can either not progress at all or progress at slightly different rates, but it's a very different experience for different people. And it's really important for us to know that, because what we need to do is essentially look at the different types of ways in which the condition can move forward and work out if we can start understanding what causes the condition to progress fast in some cases, slow in others, what makes it amenable to treatment, and what doesn't make it amenable to treatment. So what RADAR does quite nicely is that if you sign up to it, essentially what it'll do is it'll catalog you as someone who has IgA nephropathy, but then it'll follow you up over the course of your journey, collecting your blood tests, the medications that you're on, and creates this national database that we can then use for research to try and better understand the different ways in which the condition develops overall. So in terms of joining RADAR, it's a really, really simple, straightforward process. If the center you're a part of participates with it, all you need to do is essentially sign a consent form saying that you're happy to be a part of RADAR. And then what the database does is it mostly auto-collects all your information that's stored locally within your hospital. So that'll be to do with your blood tests or medications that you're on. But importantly, it won't link it directly to you as an individual. So it's stored through something called a pseudonymized ID. And what that essentially means is that the data is there, but it's not linked to any of your personal details. So if anyone ever manages to get into RADAR for whatever reason, they wouldn't ever be able to track it back to you. But the important thing is the chance of anyone getting into RADAR is incredibly small because it's very securely stored and is protected by the same firewalls that protect the NHS, essentially. So it's this absolutely fascinating resource, and it's brilliant, and it's been developed over a very long period of time. And we're collaborating with the group of people that run RADAR to try and deliver on this project. So what we're going to be doing with RADAR is that there's now over 4,000 patients with IgA nephropathy in the UK that have signed up to RADAR. And so it's this great resource that we can tap into for this. And so what we're going to be doing is administering this survey through RADAR. So it's a survey that we're going to develop, and we're going to spread the word through RADAR. And the idea is that through that, we can start understanding who with IgA nephropathy specifically gets the pain and who doesn't get the pain. So we can better understand the sorts of people that might start having pain, so we can help them even before the pain starts to set in. And then it's also really important for us to understand how often the pain happens. And this really relates to this issue over here. Sorry, my cursor is not working. The issue of time off work. So if, for example, you're on the scale of the spectrum in which you're getting pain quite often, 2-3 times a week, and you're having to take lots of time off work, that's a really good reason for why the NHS should look into researching into this as a problem and trying to come up with a solution. And then Matt mentioned that there were lots of other things that we might be able to advise patients on what they could do to try and help with the pain. And that's things like take a bath, for example, or a warm patch over the kidney. But if we can tap into as many people as possible that have experienced this and get them to share their experiences with what helps and what triggers the pain, that can help everyone. And we're hoping the survey would do that for us too. And then I'm sure a question that everyone has, because I know, and it's a question that we get asked in clinic quite often, is whether or not episodes of the pain have an effect on kidney function. And because there's very little work that's gone into this, we just don't know yet. But by linking the surveys and by administering these surveys to radar, we can get that information because we can start working out if those who have the pain more often end up having poorer kidney functions as a result of it. And we can start doing investigations like that. It'll give us a lot of useful information. So this is phase one, but I also think it's the most critical of all the phases because it'll give us the first ever insight into the scale of the problem. And this is globally. So it's going to be something very fascinating for lots of people and very useful for lots of people. But the key thing is it's also likely going to inform lots of research questions going forward. So while there's been very little to no research going into kidney pain and IgA nephropathy at the moment, as a result of this work, I'm sure there's going to be lots of questions that come out of it. And this is really going to be the seed that sort of that stems all this research that comes from it. But critically, as I explained before as well, without some level of evidence, it's very difficult for you to apply for more funding in the world of research because you need to show the scale of the problem that you're trying to solve. And this is going to give us insights into that. So I think it's also going to help us get lots more funding so that we can really start pursuing the research questions that form as a result of phase one. So how can you help us with phase one of this study? So the first thing we need to do is make sure that we're delivering a survey that's sensible and asking questions that seem relevant, that are relevant, and really isn't too long and onerous for anyone to fill out. And so what we're probably going to do once we start this is post a trial version of this survey on the Facebook group and really ask anyone who's interested in participating to give us feedback on how the survey works. And that'll probably happen over the next few months or so. And if you see it and you're a part of the Facebook group, then it'll be great to get your inputs into it because it'll make the survey that much better when we administer it through Radar. And also, if you haven't signed up to Radar yet, it's worth asking your local clinicians if you can sign up to it. Because as I mentioned, the commitment's quite minimal. All it takes is for you to essentially consent, and then Radar does the rest of the work for you. All your data is completely protected, but it informs national level research on this really amazing way. And then finally, when the survey does go out through Radar, you will get pinged only if you're on Radar, and you'll get notified through Radar that the survey is now available. And if it is available, when it does become available, it'll be great if you could try and complete that survey when you get a chance. Now, it's important for you to complete that survey even if you don't have pain, because what we need to do to show the effects of this is really compare those who have pain with those that don't have pain. So responses from everyone will be very, very much appreciated. And then the other thing you can do is really spread the word about the Facebook group, about Radar, and about the survey that would likely come out over the next few months. The other thing that we're hoping we can do in phase one is try and recruit to phase two and phase three. So phase two, as I mentioned, is where we're going to start collecting very detailed insights through one-on-one interviews and focus groups. And phase three is where we're going to really start understanding the biological mechanisms that drive this pain going forward. So phase one will be completely anonymous. So the results that we get from phase one, we will not be able to track back to any individual person. So you can be as open and as honest as you want. And what we'll do at the end of the survey is we'll provide an extra link. And if you click on that link, it'll take you away from the survey and give you an opportunity to tell us that you're interested in participating in either phase two or phase three. And if you are, you can give us your contact details and we'll get back in touch with you and tell you all about what it would involve. And if it interests you, you can take part. So phase two, to tell you a little bit more about it. So this is where we get this in-depth understanding. And as I said, it's going to be one-to-one interviews and it's going to be focus groups. Now, the information we get from this is very different to the information that we get from surveys, because the information that we get from surveys essentially represents everyone's views. So it's sort of like when you go on Amazon and you see the aggregate star rating at the top that says 4.5-star review. Now that's great. And it gives you an idea as to overall how good the product that you're looking for might be. But most of us will inevitably go down and start reading the individual reviews because there's a lot of detail that you get from those individual reviews that gives you a real feel of what it's like to use the product that you were looking for. And in terms of research and getting funding for future research, it's very similar. So we can put that sort of the 4-star rating in our research proposal to any funding organization. But what we found is that the snippets and comments that we get from you as patients directly play a big role in influencing how important this research is. So I think this part of this, the phase two of this study is really important. It's going to deliver some really, really powerful results. And so it's something I'd encourage everyone to take part in if you do get a chance to do so. And then finally, we'll have phase three. And phase 3 will be a very biological study. And what we'll do in phase 3 is we'll collect blood tests, we'll collect urine tests, and we'll try and analyze the blood and the urine to try and work out which pathways might be active when you have pain and when you don't have pain. And the pathways we'll be testing are very similar to the pathways that John showed you in the first slide that he had up, which had all the different ways in which IgA nephropathy could work and all the different treatments that we have targeting those different pathways. And this is really critical because I think that it'll do one of two things. It could either tell us that there's pathways we already know about that are active in IgA nephropathy that's also causing the pain. And if it does, that's great, because it means that we might be able to use drugs that are already in clinical trials to try and get on top of the pain. Or it might tell us something completely different is going on. And that'll give us something else for us to focus our attention on and try and develop new ways of controlling the pain that might be different to drugs that are already undergoing clinical trials at the moment. The other thing that we're hoping to do is essentially scan kidneys when you are in pain and when you aren't in pain. And that'll give us an idea as to whether or not when you get the pain in the kidneys change in size in any sort of way and really stretch to cause pain. And that again would give us an idea as to what sort of medications we can use to try and get on top of it. So ultimately, what we're hoping phase 1, phase 2, and phase 3 would lead to is phase 4. And phase 4 is really where we see it benefiting everyone, because it would give us ideas into what factors we can use to try and predict who gets pain, when they might get pain, and hopefully start bringing medications into circulation that could actually be used to treat the pain. And this is key because we're at a place right now in which we just don't know anything about this at all. And so there's very little we can suggest that might be helpful. So I'm gonna stop there, and I'm just gonna leave you with these take-home messages. And what I'm gonna say is that, so loin pain and kidney pain, they sort of mean the same thing. And kidney pain, it just in IgA nephropathy just hasn't been described properly yet. And because of that, there's been very, very little research that's gone into it. And so as a result of the work that Matt and the rest of the group did, we're now able to get funding to try and look into this for the first time ever. And that is really, really exciting for everyone, I think. It's due to start very soon. And so you will hear more about it over the next coming months. But what we're going to do first is we're going to issue this test survey first. And I think this survey is really right for us to get right at the test level, because if we can get your feedback on this, we can try and make the actual survey as great as it can be so we get as many responses as possible. I mentioned about RADA as well, which is the National Registry for Rare Kidney Diseases. So I definitely would encourage everyone to try and sign up to that if you get a chance to. And when the survey does come out, I encourage you to encourage everyone you know to participate in this too. So thank you very much for your time, and I'm more than happy to take any questions.